Hello everyone, welcome to my channel Capsa. Today's topic is about Salk vaccine and Sabin vaccine. These two are polio vaccines. So what is polio? Polio is a highly infectious disease, mostly affect young children and attack the nervous system, which leads to spinal and respiratory paralysis. This vaccine developed by US physician Dr. Jonas Salk in early 1950s. And interesting fact is he tested his experimental killed viral vaccine on himself and his family. It is given, or IPV or oral polio vaccine given in parenteral route as a dose of 0.5 ml in case of both adult and children. Two types of parenteral route are followed, that is IM and SC or ID, intradermal. So in case of IM is given into the anterolateral part of the thigh in case of children age less than 2 years, and deep SC injection is given to the deltoid muscle in case of children more than 2 years of age and also to the adult. This Salk vaccine or IPV used for the treatment of poliomyelitis. So what is poliomyelitis? I will discuss in the latter part. And it is contraindicated for the children who experienced severe allergic reaction from the previous dose. Severe allergic reaction or hypersensitivity kind of reaction which is obtained from previous dose. This type of allergic reaction actually arises due to the use of antibiotics. Okay, it means antibiotics are used as a preservative in the Salk vaccine and Sabin vaccine composition. Okay, so why antibiotics are used as a preservative? During the manufacture, to prevent the bacterial contamination, antibiotics are used as preservative. From these antibiotics, actually hypersensitivity reactions are arises. So Salk vaccine can be given to the pregnant women, breastfeeding women, immunodeficient women. Though there is no evidence that IPV can cause to harm to the pregnant women. Now what is immunodeficient or immunocompromised patient? So the patient who have weak immune system due to the particular health condition. Which kind of particular health condition? Like who have cancers or who have or had solid organ transplant like kidney or heart transplant. These kind of patients are immunodeficient or immunocompromised patient. IPV is given 4 doses for the children and 3 doses for the adult. So first dose is given at the age of 2 months, and second dose is given in the 4 month. Third dose is given in the 6 to 18 month, and fourth dose is given into the in case of 4 to 6 year old. Okay, these are the 4 dose for children. 3 dose is given for the adult. Given to the adult, first dose is given at any time. Second dose is given after the first dose, 2 months of the first dose. Okay, and third dose is given into the 6 to 12 month after the obviously second dose. These are 3 doses for adult as a 0.5 ml each time in case of children and adult. Now what is Sabin vaccine, also known as oral polio vaccine? So Sabin vaccine actually developed by microbiologist and physician Albert Bruce Sabin. So Sabin created his vaccine at Children's Hospital in Cincinnati, where he tested it on 10,000 monkeys and 160 chimpanzees, as well as on himself and on his daughter. So OPV is a kind of live attenuated vaccine given in oral route as a liquid drops. 2 drops are given, which is a dose equivalent 0.1 ml. Okay, and you need to keep in mind that OPV is not used in United States but used in the other countries. And this vaccine also used for the treatment of poliomyelitis, obviously contraindicated for the patient with hypersensitivity reactions, which arises due to the use of antibiotics as preservative and pregnant women, and can be given to the breastfeeding mother according to the Centers for Disease Control and Prevention and American Academy of Pediatrics. It is a very effective vaccine which provides lifelong immunity, and the dose, total 5 doses given from birth to adult. Okay, so how the doses are distributed? 0 dose or first dose, this is considered as first dose, is given at the birth. Okay, now the second dose is given in 6 weeks. Third dose is given in 10 weeks. Fourth dose is given in 14 weeks, and the fifth dose is given at 16 to 24 months. Okay, that is booster dose. Obviously, both IPV and OPV do not freeze, store at 2 to 4 degrees Celsius, and IPV actually used for 3 type of poliovirus, type 1, 2 and 3, and OPV used for the 2 type of poliovirus, that is 1 and 3 type. This is poliomyelitis, I have told previously. Initial symptoms are fever, fatigue, stiffness of the neck, pain in the limbs, but slowly it leads to respiratory muscle paralysis, means skeletal muscle as well as respiratory muscle paralysis, which leads to death. So this is the end of my lecture. If you like my video, please do like, comment, share and subscribe. Thank you for your attention.